Fever of unknown origin, or FUO, is one of medicine's great puzzles. A patient has a persistent fever, you run the test, review the history, check every system, yet the cause remains hidden. It's the kind of case that turns even the most experienced clinician into a detective. In this session, we will uncover what truly defines a fever of unknown origin, explore some of its potential causes, and walk through a clear, logical approach to solving it. Because behind every unexplained fever lies a story, and our job is to find it. So, what is fever of unknown origin, or FUO? Classically, this is defined as any fever that exceeds 38.3 degrees Celsius that persists for more than 3 weeks, okay, and remains undiagnosed after 1 week of in hospital evaluation or 3 well documented outpatient visits. So, this definition emphasizes both duration and diagnostic effort. But just to clarify, we don't actually need to wait a full week of hospitalization before proceeding with a thorough workup, right? The key is the depth of the evaluation and not the duration of the stay. So, in other words, there is no need to keep your patient captive just to make it official. So when it comes to fever of unknown origin, infections top the list of causes, so that's always where to begin. Think bacterial first. And remember, bacteria love to hide. They rarely stay where we expect them, right? Look for abscesses tucked away in places like the intra-abdominal cavity, especially the subdiaphragmatic spaces in the liver, spleen, kidneys, or pelvis. Localized infections can also turn up as osteomyelitis and sinusitis. If you find bacteremia, don't forget to check for endocarditis. That's a classic source of lingering fever. And of course, mycobacterial infections deserve special attention. Tuberculosis is still one of the most common culprits worldwide. In immune compromised patients, especially those with HIV and CD4 counts less than 100 cells per microliter, think of Mycobacterium avium complex as well. Basically, if the immune system is down, everything that's ever seen a petri dish wants to join the party. Now, moving on to viral infections, you can watch out for cytomegalovirus and Epstein-Barr virus, both known for causing prolonged fevers. Fungal infections can also play a role, particularly candidiasis, aspergillosis, histoplasmosis, and coccidioidomycosis, often opportunistic and seen in the same immune compromised settings. And don't forget the parasitic group, amoebiasis, malaria, and toxoplasmosis are all key players, especially with relevant travel or exposure histories. Finally, the spirochetal and the rickettsial infections such as syphilis, leptospirosis, Lyme's disease, and rickettsial fevers all deserve a spot on your differential. Another important category in fever of unknown origin is neoplastic febrile syndromes. In other words, fevers that are driven by malignancy rather than infection. Keep in mind that lymphomas, especially Hodgkin's and non-Hodgkin types, are classic causes of fever of unknown origin. Leukemias can also present with prolonged unexplained fevers, often before other obvious signs appear. Don't overlook solid tumors either, particularly liver cancer, which can produce fever through tumor necrosis or cytokine release. And for the rare but memorable atrial myxoma, the cardiac tumor that loves to masquerade as infection. If your patient has fever of unknown origin and a mysterious cardiac findings, it is also worth a thought. Now, when approaching a case of fever of unknown origin, there are a few important basics that can make all the difference. First, always rule out factitious disorder. When the story just doesn't add up, sometimes the mystery fever isn't from pathophysiology, it's from the patient's creativity. Second, pay attention to symptoms, signs, and lab findings that might connect with the fever. Small clues often point to big answers, right? And third, never underestimate the power of a thorough head to toe physical exam. It's free, it takes only your time, and can uncover what expensive scans might miss. And finally, remember cost effectiveness. The workup for fever of unknown origin can quickly become very overwhelming, both mentally and financially. So a stepwise logical approach saves not just effort, but few dollars too. In short, think smart, examine well, and let reason lead before the lab tests take over. So, when working up a patient with fever of unknown origin, the key is to follow the clues, right? Each one can lead you closer to the source of the fever. For example, a persistent headache with a normal cerebrospinal fluid should prompt CT or MRI imaging to rule out intracranial abscess or even sinusitis hiding out of sight. Heart murmur with fever, always think endocarditis, get blood cultures, and an echocardiogram right away. If you find lymphoadenopathy or cytopenia, that's your cue for a lymph node or a bone marrow biopsy. Hematuриas that accompany may also suggest a renal source. Consider ultrasound or CT imaging. And if there is a bone pain right there, you can also think to order bone scans to rule out osteomyelitis. Generally, the abdomen deserves special attention. It's the perfect hiding place for infections, and abdominal and pelvic CT scan is often your best starting point. Also, don't forget stool studies for culture and parasites, especially if there is any gastrointestinal involvement or travel history. For conditions like tuberculosis, syphilis, malaria, amoebiasis, Lyme's disease, or Rocky Mountain spotted fever, go for serology or blood smears. A rheumatologic workup can also help uncover autoimmune as well as vasculitic causes when infections and malignancy seems less likely. And for the elusive cases, radionuclide scans, endoscopy, or even exploratory laparoscopy may reveal what conventional imaging misses. As you can tell, the list is long. We could probably spend the whole night going over every possibility, but let's hope you've caught the clues before we both need a coffee refill. In the end, the management of fever of unknown origin always comes down to one key principle: treat the underlying cause once identified. There is no one size fits all therapy, just thoughtful investigation and targeted care. Thank you for staying with me through the mystery of fever of unknown origin, and as always, stay curious, stay safe, and stay well.
Thank you, and I hope this was useful. If you enjoyed it, then hit the like button and subscribe to the channel. Bye.